You heard a lot today, and I apologize for the many hours you've had to sit and endure it. Mike, I share your shock. But what I'm seeing is it is just a piece of paper. It's about physicians who charge a lot of money, who will make a phone call once a month, or they'll check in to review files for 30 minutes that the patient care has already been delivered, the prescription's already made, the patient's seen and left, and they're simply looking at it in the past tense. The very idea that Lynn County in Littlefield, Texas, has to pay $96,000 just for folks who may be part of that, as Dr. Berger says, the home care team, health care team. Healthcare team in rural Texas is a nurse practitioner by herself in a little clinic in a community. That's all there is. That's all there is. Within 1 hour driving distance of San Angelo, there's a nurse practitioner manning a clinic by herself, paying a doctor four figures, over $100,000. Now, let me tell you what $100,000 would do for that lady. She could buy some technology. She could buy some equipment. She could hire personnel to see these patients. One of the witnesses said 2 standards of care. You're exactly right. There are 2 standards of care. And so these folks in white coats, I don't know, they think there's going to be blood in the committee room here. You know, what I didn't hear is anybody with a white coat saying that they were going to practice in rural Texas. That's what I didn't hear. They're practicing in large urban areas, big hospital groups. Some of them bought and paid for by private equity groups. Well, what I'm here to ask is for your consideration about how do we meet access to care in rural Texas. That's what I care about. That's what I hope you care about too. What we're doing now isn't working, folks. It's just, you can talk about GMEs, loan repayment, shortages, but what we don't have is doctors willing to move to rural Texas. We do have nurse practitioners that are highly trained, highly qualified, actually providing those services, willing to live and work in rural Texas, providing those services now, but yet they have to pay for that piece of paper, Mike. That's what we're trying to move away from. 27 states have already moved away from it. This state moved away from it during COVID. All of a sudden now we have to worry about it. When during COVID we didn't have to worry about patient care and safety. Do we think that the VA hospital or United States military aren't concerned about patient outcomes? That's what's so frustrating about this whole issue. When we have the trial lawyers complaining about this, well, only 4% of APRNs have been committed malpractice, when over 71% of malpractice claims come for physicians. Yeah, I bet they would complain about that. They'd rather have physicians on the hook than nurse practitioners. So folks, there's been 4 or 5 hours of folks up here complaining about actual delivery of services in rural Texas, quality service that people rely upon, that they have confidence in. But yeah, we've got people in white coats living in big cities looking down their nose and said, they don't do it like we'd do it. Folks, you want to live in cities? You need what we have in rural Texas. You need our oil. You need our food, fiber, hide, hair, electricity to live in cities. If we don't have quality health care in our rural communities, nobody's going to live there. There are 27 counties that you cannot deliver a baby. What are you going to do about that? What are we going to do about it? Are we going to listen to people in white coats looking down their noses at us? We're having to live in these areas, underserved areas, without access to quality health care. And if we don't, you think mama's going to live in a community that her children don't have access to at least somebody? I don't care if it's a nurse practitioner. That somebody is there in that community. That's what this is about, folks. It's not about some large medical group in Houston, Dallas, supervising their nurse practitioners. Yes, it is about that. I happen to think that they're qualified to do the services that they have been trained to do. So put your thinking caps on, folks. There's work to be done. We can talk about brackets. We can talk about a service requirement where these folks have to stay and train for so many years before they have independent status. But are you asking these folks that have been trained to perform services, are you saying that they need to be residents, serve a residency their whole time, their whole business career? They've got to be a resident. They're never going to have full practice status for what they've been trained to do. I apologize. There's 7 members out here waiting for bills to be heard. You spent 5 hours talking about this bill. I apologize to them. I apologize to you. But this is too important not to put it on the table, folks. Let's try to find a solution. Texas should not lag in this and be the last state in this country to allow this practice to happen. Thank you. With that, I close.